Hello, welcome to our channel. In this video, we will discuss about allergies, and we will cover what we keep an eye on for allergy symptoms. Allergies are a big part of life for our family. Some of us get the mildest form of the occasional sniffles, while others get the more serious form that we had to get an ambulance to be transported to the hospital as soon as possible. For sure, this can be very scary. Our hope is that by sharing what we have learned and experienced, it can make the journey a little easier for someone else and maybe even save someone's life. Let's begin. Seasonal allergies. We are always on the lookout for mild symptoms during the spring and the fall. Hence, the description, seasonal allergies. We will break down the symptoms into nasal, eye, throat, breathing, and general symptoms. Nasal symptoms. Sneezing. The sneezing usually comes suddenly, frequently, and in bursts of 5 or more sneezes coming in together. Runny nose. The discharge is usually clear and dripping, almost free-falling. Stuffy nose. If there is inflammation, there will be congestion. When you talk, it will sound like you are pinching your nose at the same time. Postnasal drip. This is when the clear discharge that goes out of the nose also goes out through the back of the throat. Eye symptoms. Swelling. Bumps will appear around the eyes. Also, the eyelids may appear puffy. Redness. The redness can be around the eye, or the white part of the eye will appear pink or red. Itchy eyes. The person having allergies will always be rubbing his eyes and can't seem to stop himself from scratching. Watery eyes will look like tearing up with frequent blinking. Itchy throat. You will hear them always clearing their throats and also making clicking sounds with their tongue and upper palate. Throat symptoms. Sore throat. You will notice difficulty in swallowing, also loss in appetite. They don't like to eat because it hurts to swallow. Breathing symptoms. Wheezing. There is a whistling sound when they breathe. Shortness of breath. They will appear like they are always catching their breath, and you will notice their shoulders are higher than normal. Coughing. It is mostly dry cough, but it may sometimes be accompanied by mucus, although not by thick phlegm. General symptoms. Fatigue. Allergies can disrupt sleep, causing tiredness. Headache. Maybe due to pressure or inflammation in the sinuses. Mood changes. They can appear short-tempered and irritable. Difficulty concentrating. Having trouble focusing on tasks or conversations. Do you have allergies due to an insect sting or medication? Go ahead and share your experience in the comments below. It will help others understand allergies better and raise awareness on how to identify them. Food allergies. Food is the major allergen for our family. Exposure to them has caused a life-threatening condition known as anaphylaxis. Anaphylaxis is a severe, rapid-onset allergic reaction that can be life-threatening if not treated immediately. It occurs when the immune system overreacts to an allergen, such as certain foods, insect stings, medication, or latex, releasing a flood of chemicals that can cause the body to go into shock. Anaphylaxis requires immediate treatment with an injection of epinephrine, or adrenaline, and a trip to the emergency room. Without prompt treatment, it can be fatal. Due to our food allergies, we are very careful with the ingredients on food items we buy, and we almost always make home-cooked meals and rarely eat out. Here are the symptoms we have encountered due to food allergy. Skin rash and itching. We notice bumps form on the skin that has been exposed to the food allergen. They look like raised patches of pink-red little islands that popped out of the skin. Swollen lips. The person having the allergic reaction would have puffy and distended lips. Swollen ears. The ears appear bigger, red and warm to the touch. Diarrhea. This is also accompanied with abdominal pain and cramping. Vomiting. Almost instantly, their body will try to reject the allergen that was ingested by throwing up. Wheezing, shortness of breath. You will notice the chest going in when they inhale, and their shoulders usually rise. You will hear a whistling sound too when they breathe. Blue or darkened skin and lips. This is due to lack of oxygen. Other symptoms that are anaphylactic reactions, which we have not experienced, but you may want to look out for: swelling of the tongue, tightness of the throat, dizziness and fainting, or loss of consciousness. During the emergency, we have observed the medical team, both in the ambulance and in the emergency room, checking for pulse, blood pressure, heart rate, and oxygen levels. We know from experience that anaphylaxis can be terrifying. It is overwhelming and frightening. But in those moments, try to be focused. It is important to keep calm and be clear-headed as much as possible. We hope this video is informative. If you are caring for a child or managing your own symptoms, remember, identifying allergy signs early can make a big difference. Stay informed, trust your instincts, and don't hesitate to reach out to a healthcare provider when needed. Take care, and see you on the next video.